Hello, my name is Anna Bivens, and I'll be talking about methods of integration. Leadership, it means working with and through to make a change. To make a change, leaders should have 5 key questions in making a change. What is the impetus for change? Meaning, what is the motivation for change? The next thing is in the book, Quality and Safety in Nursing talks about how we can look for many possible reasons for change. Questions like, has a review of patient satisfaction data indicated an unacceptable level of performance? Is there new technology being introduced for which people need to be trained? Another question is to keep in mind when making a change is, who are the key people that need to be involved? One leader can give permission to create the change while the other is the operational leader in providing support and guidance. The next question is, how will the change be rolled out? Thoughtful planning and input, or gathering that input, is key, as well as keeping people informed. In preparing to initiate a change, leaders should assess the organization's readiness for change. The next question is, how will the success be measured? There is an importance of the leader having an envisioning the future and how to better do a task or a policy and procedure that has room for improvement. The leader has the idea, co-creates with others to gather support, and the next question would be then to, how can we accelerate the diffusion of healthcare and innovation? So part of initiating a change is selecting the right leaders to lead the initiative, those with credibility, capacity to change, and have the necessary skills. Now, the book talks about 2 different models for change. The one I will focus on is head, heart, and hand. The other is Cotter's for change, or Cotter's model for change. Now, head meaning the logic of analysis and recommendation. Heart, why the client should have this change. Hand, how to make the change easy to implement. Now, there was an article that I was looking at, which is Transformational Leadership. And this article mainly that I wanted to focus on was the human resource management practices that are particularly important for successful change in implementation. So having these things could have a successful outcome and change. So ongoing communication, training, use of mechanisms for measurement, feedback, redesign, sustained attention, and worker involvement. Now, one of the examples I want to focus on is telemetry monitoring. Now, there are many issues that with telemetry monitoring that have room for improvement to increase patient safety. Now, there was an article that was talking about telecare providers that are learning on the job rather than formal training sessions and are not formally certified for telepractice services. In this article, they concluded out of 6 studies that there needs to be more training and education to adequately prepare telecare users. So, for example, in our hospital, I think this would be very beneficial to teach new nurses how to formally work with these type of devices or any other technology to improve patient safety. Now, there are many types of policy and procedures or interventions that need room for improvement. We always talk about decreasing central line infections or Foley catheters, decreasing the use of Foley catheters, and there are so many more things that we focus on to just prevent complications, and there are bundles and other interventions that need room for improvement. But in order for this to happen, we need a good leader in place to initiate this change.